Most therapists do not know how to help mentally ill people, and most therapeutic techniques are not designed to help mentally ill people. I know those are fighting words. Fellow therapists, do not get mad unless I'm actually talking about you. But think of it this way. Imagine going to physical therapy, and the physical therapist starts your session by asking you where it hurts. And so you tell them where it hurts, and you describe the nature of your pain in the greatest detail you're capable of. Then your physical therapist says, what happened? How did you become injured? So you walk through the events that caused the pain, and you're starting to feel hopeful. This person understands how you feel. They know what happened to cause it, and this feels like a great start. You feel validated, you feel understood. All that's left is to create a plan of action to reduce your pain. And that's when your therapist says, hey, this was a good session. I'll see you next week. And you're a little disappointed because you're certain that you'll start doing some exercises next week to work on relieving the pain. Unfortunately, when you go back next week, it's just more of the same. More describing your pain and the circumstances that caused it, no plan of action, no method of resolution, just talking about what hurts over and over again with the assumption that this alone will heal you. That is what most therapy feels like to me, and I don't like it. It feels like constantly waiting for answers that never come, and ever-growing frustration that this person, this therapist, either knows what I can do to feel better and for some odd reason is refusing to tell me, or they have no idea and they're just making this up as we go. And don't get me wrong, this process of understanding the nature of a person's pain and the details of their backstory is important. I'm not saying we shouldn't be doing that. But in and of itself, that process, in my opinion, is not an intervention. Just getting to know someone and understanding their history and why they hurt and how they hurt does not automatically help them get better. And that's all a lot of therapists do. When I first got into this field, I found myself asking the question, would this have actually helped me when I was at my lowest point, when I would see examples of a lot of the most well-renowned people in our field doing therapy sessions? And I realized, no, this would have done nothing for me. Like if I was this person's therapy client, they would not have been able to help me. And that's what leads me to my conclusion that the general principles of most modern therapeutic practices are woefully inadequate for anyone with a serious mental health condition. Two of the most frequently emphasized rules in most graduate programs for therapists and most agencies where therapy is offered are: 1, do not ever give direct advice to your therapy clients. And 2, do not talk about yourself or your own experiences. Let's think about the implications of these rules in combination with one another. If I cannot advise you directly or talk about my own experiences, all I can really be to you is a sort of paraphrasing and summarizing mirror of what you say to me, which, if you're anything like me, feels a little bit like talking to like a well-meaning, kind brick wall and not an actual human being. If your therapist functions as this type of mirror, that means they believe the answer to your struggles already exists inside of you, and all you need in order to discover it is a safe, supportive environment. To which I say, listen, friend, I'm a fairly smart guy, and I've been working hard on this for quite some time. If I was capable of figuring this out on my own, I would have done it by now. I'm here asking you for help because I've determined that I can't do it by myself, and the answers to my questions do not live inside of me. Now, there absolutely are situations where a therapist should not give direct advice. Don't get me wrong. I often tell my clients, I don't know who you should marry or what you should do for a living just because I talk to you for an hour a week, or what house you should buy. I also don't think a therapist should just use their own life as an exact template for how their clients should live, because people have different goals, values, personalities, etc. I believe the most effective form of therapy lies somewhere in between the extremes of a therapist who thinks they're master of the universe and everyone should just do what they do, and a therapist who refuses to provide any direct strategies or guidance. It should be a collaborative approach between the client, who is the relative expert on themselves, and the therapist, who should be a relative expert on behavioral principles and mental health in general. And the overlapping combination of these two domains of expertise, I believe, is what creates meaningful change. If either element is missing, people get stuck. If you expect therapy to be comparable to other forms of healthcare, where your provider understands what's wrong and can create a clear, form of action, a clear plan that is going to relieve your symptoms, you're probably going to be disappointed because very few therapists are capable of doing this. Severe chronic mental health issues are debilitating. Most days we either can't get out of bed, or if we do force ourselves to get out of bed, we spend all day feeling hollow and empty. We feel lost, alone, helpless. We question our humanity. We question the reality of our own existence. We feel like mistakes who should have never been created or were put on the wrong planet. These types of struggles are not the result of living a somewhat unfulfilled life or not being in full alignment with our values. They go deeper than that. Something is wrong with our brains. They do not work as intended. We need help. We do not have the answers to our own questions. We need a complete overhaul of our internal systems. We need to burn down large portions of our lifestyles and begin the long, arduous process of building something functional. Most therapists have no idea how to do this, and I don't necessarily blame them for that because I'm not aware of a single educational program in the entire world that teaches a person how to do this. The only reason I know how to do that is because I had to do it myself for my own life. So at this point, you're probably wondering what the solution is. And this is where I'm going to disappoint you a little bit because I don't know. Mental health care, in my opinion, is a fundamentally broken system that I happen to be in. The most skilled providers want to work for the agencies which offer the highest reimbursement and the best benefits, which are typically private practices, such as the one I own. Most private practices only accept commercial insurance because commercial insurance has the highest reimbursement rate, and that's how they're able to pay their providers more. Most people with commercial insurance have good jobs. And most people who have good jobs, not all, but most people who have good jobs are not severely mentally ill. So in general, the best therapists end up working with the highest functioning people who are seeking treatment, and the people with more severe symptoms get stuck with interns and trainees because their symptoms prevent them from getting good jobs, which would provide them with better mental health coverage that would allow them to see the best providers. The whole system is upside down. And I don't know how to fix it, short of creating my own private practice, which I've done, which hires the best people, but takes every type of insurance. But not a lot of places do that. So I want you to know that I'm just as frustrated as you are by this whole thing. I know that when you're really struggling and people say go to therapy, it's not as easy as just like, you're sick, so go to the doctor. It is very, very hard to find someone who is the right fit, who has the right skill set to help you. And there's no foolproof way to tell the difference between the therapists who really get it and the ones who don't, sort of meeting them, which is time consuming, frustrating, and sometimes expensive, depending on your insurance. So that being said, even though I don't have any quick or easy answers for you here, I do hope you keep trying because therapists with the skill set to help you do exist. I've hired several of them, which does you no good unless you happen to live in Iowa, but Iowa is not exactly a hotbed of like schools and mental health talent. We're actually a bit of an underserved area. So if I can find those people here, you can probably find them wherever you are. I really hope that you keep trying, and I really hope that you do not lose hope, because if therapy has not helped you so far, that doesn't mean it can't. If people with a chronic, severe mental health issue find a therapist who can help them on their first try, or even their second or third try, that is statistically unusual. Because just to go full circle, the way most therapy is done is not made for you. It's not made for a severely mentally ill, chronic person. It's made for what we call the worried well, which is people who are like okay but want to be better. People who are unsatisfied, unfulfilled, missing certain pieces of their life, but like their life is not falling apart. They're not unable to get out of bed. They're not unable to function. They just aren't great. That is the person that probably 80 to 90% of therapists have the skill set to help. So if that's not you, if you're someone who's really like on the bottom of life looking up, the person you are looking for as a therapist is a relatively uncommon person. They are not mythological. They do exist, But you can't just like pick someone who has a nice smile and takes your insurance and be like, well, that should work. Because we consider therapy healthcare and it should be healthcare, but it really does not follow the same rules and regulations as a lot of healthcare disciplines. It's not like you have this, so we will do this. There's a lot more subtlety and nuance to it. So I hope that you do not give up. But I also hope that you have realistic expectations about what you're looking for and that you know it is most likely going to take some trial and error for you to find that. I will continue to make content that I think will help people find therapists who are the right fit. But I want you to know that if you haven't so far, that is almost certainly not your fault. Because most therapy is not designed for mentally ill people. As frustrating and stupid and ridiculous as that sounds, it's true. I wish it wasn't, but it is. I hope this helps, and I'll see you next time. Take care.